Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. We are announcing the 44th, 45th, 46th, and 47th death due to COVID-19. We have a male in his 80s and a male in his 70s from the Winnipeg Health Region and are linked to the Parkview place. A male in his 80s from Winnipeg Health Region and a male in his 80s from Interlake Eastern Health Region. These cases have been previously announced, and we would like to extend our condolences to their family and loved ones, as well as to the loved ones of the two deaths announced on Wednesday. Our current 5-day COVID-19 test positivity rate is 5.6%. with 147 new cases of the virus being identified as of 9:30 a.m. Total lab confirmed cases in Manitoba is at 3,773. For today's cases, we have 7 in Prairie Mountain Health, 10 in Interlake Eastern, 10 in Northern Health, 33 cases in Southern Health, and 87 cases in the Winnipeg Health Region. 1,806 active cases with 1,920 individuals recovered. We have 42 people in hospital, 8 of which are in intensive care. Total number of deaths due to COVID-19 is at 47. The average wait time for HealthLinks is 94 minutes, and the median test turnaround time, the total test turnaround time is 48 hours. Our lab testing numbers show 2,220 tests were completed yesterday, bringing total number of lab tests completed to 233,222. Some testing sites have extended their hours, so please visit our website, manitoba.ca, for updated information. We have advised that an outbreak has been declared at Arborgate School in La Broquerie. The school has been elevated to orange on the province's Restart MB pandemic response system. Public health officials have advised that an outbreak has been declared at Ochekwe Sipi, personal care home in Fisher River, Cree Nation, due to a positive case in a healthcare worker. The outbreak at Bethesda Place personal care home has been declared over, and all possible exposures are now posted online on the pandemic response system. Due to increasing case levels in northern Manitoba, we have new COVID-19 public health orders are being issued for Northern Health Region as well as Churchill. Will be effective this Monday, October 26th, for a minimum of 2 weeks. The travel restrictions will remain in place and unchanged at this time. These new restrictions will be implemented in the same manner as those that are in place for the Winnipeg Metropolitan Region. So it includes reduced gathering sizes, the closure of casinos, bingo halls, and entertainment facilities, reduced occupancy for most facilities, and increased contact tracing by organizations and businesses. We have been actively consulting with municipal, Indigenous, and other leaders in the North throughout the pandemic, and especially regarding this pending change. We'll continue to work with all our partners in that region moving forward. Again, as we've always said, these restrictions will come into force on Monday, but no one is required to wait until Monday to start imposing these actions. We don't need to be in a region with restrictions to start reducing our contacts. We know we've seen increasing cases in all of our regions. And we've seen an increased number of cases or contacts per case. And so we all know that we need to get back to those fundamentals, to reducing our contacts outside of our house, regardless of what region we're in, and starting now, not waiting for orders to apply to you. So we've expanded the restricted level to the north. We're also making changes to what the levels mean for schools. So we know that our schools in Manitoba have been proven to be safe and low risk for transmission of the virus. We've seen minimal school-based transmission. We've seen that the public health measures, including cohorts, have been effective. And we've seen that administrators, teachers, and staff have implemented these measures very consistently and have handled our cases with great responsiveness, confidence, a great deal of professionalism from our colleagues in education. We are seeing, though, more widespread community transmission. So this increases the amount of cases we see in school, even though they're not acquired in school. And so as of Monday, we'll put further measures in place in the Winnipeg Metropolitan Region and for the north, and only for as long as those regions are in the restricted level. So schools must ensure 2 meters of physical distancing to the greatest extent possible, and adjust classroom spaces as necessary, removing excess furniture to create that additional space. Other spaces within a school, like libraries, common areas, must be repurposed to accommodate this. Extracurricular activities are only permitted if all learning and distancing requirements have been met. If these activities continue, established guidelines must be followed. And in the case of sports, participants should maintain distance when not active. Teachers and staff who move across cohorts of students, including substitute teachers, are required to wear medical masks. Medical grade disposable masks have already been issued to all schools. N95 masks are not required in these circumstances. Indoor choir and use of wind instruments are not permitted. Field trips must be postponed or canceled. There'll be no change in blended learning, where students split their time between home and school for grades 9 and 12, where distancing cannot be achieved. K-8 students may be offered a temporary remote learning option for the duration of the restricted level, and all other public health measures will remain in effect. So as we see these increasing case counts throughout Manitoba, especially in Winnipeg and Northern Region, we know that it's all a result of increased contacts. So we find the cases, we've demonstrated how one case can result in many contacts in many cases if we all have many contacts outside our household. So we really need to focus for this time on reducing our contacts outside the household, getting back to those fundamentals, and we know what those are, and we know they're challenging, but staying home when we're ill, and we've spoke plenty of times about that this isn't occurring all the time, that we see infectious people at work and out in public at gatherings, and this certainly can be avoided. So stay home if you're ill, even if mildly ill. Wash your hands frequently, practice that physical distancing, avoid those indoor crowded places, prolonged indoor contact we need to avoid. And we know we have an approaching respiratory virus season, and that's largely influenza. And so we know we have a new fundamental to add to our list, and that's obtaining the flu shot. All eligible Manitobans should be vaccinated against the flu, and I'd encourage you to do so in the near future. So all Manitobans age 6 months and up, I'd encourage you to receive that vaccine. Call your healthcare provider, pharmacist, for when those shots are available, and please do get them. We don't yet have a vaccine against COVID, but we have a safe and effective vaccine against influenza. And so we all need to do our part to decrease what we can for this respiratory virus season that's coming. There's a contact tracer hoax. We've been informed that People have been contacted by people who are claiming to be public health nurses coming to their door. So those who have been tested for COVID-19 will receive a phone call from public health. Public health officials do not typically go door to door. Anytime the public is contacted regarding COVID-19 by public health officials, they will state their name and credentials. On very rare occasions will public health come to your house if you're unable to contact you in any other way. We encourage the public to ask for more information on those credentials at any time. Winnipeg Police Services is advising that if the encounter is suspicious, call police at their non-emergency number, but certainly if the encounter became aggressive or violent, call 911. It's disappointing to hear of recent medical services again being denied to individuals because of their line of work. We can't accept this. We know this virus will be here for the foreseeable future, so we can't deny care to people based on their occupation. We need to live with this virus and deal with it. Often the people who are being denied care are providing tremendous services to Manitobans. So please, we can't stigmatize people. We can't deny access to care people based on their line of work. So let's all do our part to get through this together. And we know that stigma plays a very adverse effect on our way to manage this pandemic. So please be kind and let's get through this together. So thanks. I can open up to questions now.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary question and two follow-up questions today. First, we go to Thompson, the Thompson Citizen, and Ian.
Hi, Dr. Roussin. Ian Graham from the Thompson Citizen. What kind of factors triggered bringing in higher restrictions in the north? Like, was it community transmission, or what played a role in that decision?
Yeah, so like all of these decisions, it's multifactorial. So we know we've seen increasing cases there. We've seen increasing test positivity. We've seen increasing non-epilink cases, the community-based transmission. We've seen cases in vulnerable settings, in some the people who are homeless or living in shelters. And then, of course, we know that the north is already at risk for transmission of this virus, especially in remote, isolated communities. Access to healthcare, and so it was decided that we should now implement that orange restricted level without further delay.
Do you know, like, what is the test positivity rate around for the north now? Do you know?
Yeah. For the north, we're at 4.6%.
Okay, and just lastly, I guess there have been cases linked to, I think, 3 schools so far in the north as of yesterday. So what was the reason that decided that this would be the time to move schools to the orange restricted level?
It's kind of like we said there. It's not really based on what we're seeing within schools. It's based on what we're seeing in the community. So when you have higher rates of community transmission, that's going to lead to higher rates in any setting, including schools. So once we found, for the most part, when the virus is introduced into school, we haven't seen much transmission within the school, which again shows, displays a lot of the hard work that our education colleagues had been doing. But we just know we're going to see more and more cases in the community, and so this is a good time to ensure we're even taking further steps within the schools.
From the Steinbach Carillon, Jordan.
Good afternoon, Dr. Roussin. There's 27 cases and counting at the Exceldor poultry processing plant in Blumenort. According to the company, the first employee there tested positive on October 8th, but the Manitoba Health investigation is still pending. Why that delay, and when will that public health investigation get underway?
Well, the public health has been working along with this group and these cases right from the beginning, and so there's going to be a inspection performed this week with the CFIA, Manitoba Agriculture, Workplace Safety and Health, Public Health there, but the investigation is pending because we're still seeing cases. We have the 27 total, but 13 are active. And so we haven't seen evidence of workplace transmission. We were seeing, again, a lot of this is acquired in the community, but we're working quite closely with that area.
Given the number of employees at that plant who commute from Winnipeg and other metro region municipalities, are you considering including the plant in the level orange restrictions, even though it lies just outside the metro region?
Well, we haven't taken anything off the table. We haven't specifically applied it to this business, but we are seeing transmission in most of our regions now, and so we need to watch this very carefully and see where and when we may need to elevate the pandemic response system in the other regions.
And how many cases are linked to Arbor Gate School in La Broquerie, and is there evidence of in-school transmission there?
So there is 3 cases, I believe, at that facility, and I'm not aware of transmission within the school ongoing. When you have sort of 3 cases like that, it's probably all within a cohort, but I don't have the details on that.
From the Brandon Sun, Emily.
Hi, Dr. Roussin. My question is if you could please tell me how many and at which correctional facilities in the province there are confirmed cases of COVID or
So we have in Headingley, we have a total of 32. At Milner Ridge, there's 2. At Winnipeg Remand Center, there's 1. Brandon Correctional Center, there's 1. And Manitoba Youth Center, there is 1.
Okay, and do you know if the confirmed case at the Brandon Correctional Center, whether or not that is a guard or an inmate?
It's staff.
Okay. And then my last follow-up question here is, can you tell me the total number of, as of today, the total number of deaths that have been linked to the COVID-19 outbreak at Parkview Place?
Yes. So that is 14.
From Global, Brittany.
Good afternoon, Dr. Roussin. When we're seeing community transmission still so high and our numbers still so high here in Winnipeg, I know you're implementing further restrictions, but what more is it going to take, and how quickly do you think these numbers can start to finally go down?
Yeah, well, it's going to depend. We have these restrictions in place for relatively short period right now, so we're going to have to see what these numbers do as we have these newer orange restrictions in place. And again, messaging to Manitobans is that we can't be back to normal. We have to reduce the number of contacts we have outside our house. We have to stay home when we're ill. Because if we don't see these numbers going down, if we see increasing demand on the healthcare system, then further measures will have to be put in place. And so now is that time to act, and we all know what to do. We've all done it before, and so we can see these numbers come down. It's going to be within the next week or two if these restrictions are working, and so we'll follow it quite closely.
This is the highest number of deaths we've seen reported in one day, also the highest number of hospitalizations and people in the ICU. Can you just, I guess, reflect a little bit on those numbers and how our hospital and healthcare system is able to keep up right now?
Yeah, and so I think this is the issue with the virus is that, certainly one of the biggest indicators that we look at, and one of the most important goals in a pandemic response is to decrease morbidity and mortality and limit the strain on your healthcare system. And so right now, the healthcare system is coping with this. However, we're seeing increasing severe outcomes, so increasing hospitalizations, increasing ICU, and unfortunately increasing deaths, and that's all related to the amount of cases. So we have a relatively small yet predictable amount of people that will experience severe outcomes, and so the greater the amount of cases, we're going to expect to see more of those severe outcomes.
And can you tell us what the test positivity rate for the Winnipeg region is?
Yeah, 6.5%.
From CJOB, Clay.
Dr. Roussin, can you just further expand on a statement that you made a little earlier? Some people, because of their line of work, are being denied medical services. Can you tell us what kind of line of work we're talking about?
So for most recently, a lot of this was coming from truckers. Were advising us that they were being denied medical appointments. Some were saying they were denied influenza vaccine. And so these are reports, but we take them seriously, and we want to just ensure that we're not stigmatizing groups. That we want to ensure that we're providing care to to all Manitobans. Because it's not like this is going to be over in 2 weeks, so we just can't deny care to people. So please think about how we can work together through this and do whatever we can not to stigmatize groups.
So these are truckers who some instances are being denied even getting a flu shot?
That's the report we've received from individuals.
All right, just a quick follow-up. Is there any evidence that some students in our school system are contracting the virus from still being engaged in activities outside the classroom, outside the schools?
So you're asking are students who have been cases or contacts not properly self-isolating?
Correct. If they're still gathering in groups, if you've received any reports of that.
We haven't received any specifics like this. So, public health follows daily with cases and contacts to review the importance, to review if they are in fact self-isolating, and then to review their clinical status.
From the Winnipeg Sun,
All right, thank you.
Scott.
Good afternoon, Dr. Roussin. First question for me: what you talked last week about running out of tools under the orange banner, under the PRS. Is red the only option next, or you still have other things you can do under orange before that happens?
Yeah, so it's all a grade. We want the PRS to to provide that easy signal, but there's many options within each level. And so when you say we're running out of tools, we're really running out of targeted tools, because we're seeing widespread community transmission. So the further type of things that we have are just further capacity restrictions at venues. And so the more widespread the transmission is, the less able you are to target the transmission hotspots, which means you have to just focus on any place that people can gather. So the next steps are just further capacity restrictions on a broader basis.
Okay, thanks. My first follow-up is, are we seeing now the effects of Thanksgiving, and do you see, how was the messaging received? It looks like, the cases are starting to go up again, and you said we would start seeing the effects of Thanksgiving this week if that was the case. So what are you seeing?
Yeah, and so it's it's early to tell. We've seen some of over the weekend prior was relatively lower numbers than what we have been seeing, and then seeing a couple days like this. So we'll have to see the trend. It sure could be related to that Thanksgiving weekend. We know that it's definitely related to people gathering more. That's why we see these numbers, and so that's the message we're trying to get there, is that we have to, at least in the relatively short term, we have to really decrease our contacts outside of our household.
Sure. And just for my final follow-up, the federal government today is looking at replacing 14-day quarantines at airports with rapid COVID-19 testing, giving the worry about travel cases being reintroduced, all that kind of stuff. What is your thought on that? Because I obviously know you don't have any real control, I suppose, over what the feds do, but I imagine that's not something that you would be wanting at this point, given our situation.
Yeah, well, we have to look at the plan. The plan can't simply be to just have a rapid test at the airport, and then and if it's negative, then that's the end of things. We have to have the ability to follow up with these individuals at certain testing points. So there is some evidence that if you get a negative test upon arrival, and a negative test again 5 to 7 days later, and possibly again at 10 days later, then you're really dramatically decreasing the chances of that this person would ever convert. So there is a possibility to shorten that 14-day period, but it certainly can't be eliminated outright just with one test.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. In Ottawa, your counterpart, your medical officer counterpart there, ordered the Ottawa Hospital to take over management of a long-term care home that had 64 residents, 28 staff infections, and 11 deaths. Parkview Place is above that on every metric. When will you order a hospital or the Winnipeg Health Region to take over management of Parkview Place?
Well, the Winnipeg Health Region is in daily contact with them for quite some time now. So they have themselves been virtually looking at that. They've done an unannounced visit this past weekend and made some recommendations. So they are actively involved in in that right now. So further details I would direct to the region, the long-term care program that's following it. But we don't have any immediate plans for me to order any place to be taken over.
All right, thank you for that. What can you tell us about the index patient in the St. Boniface Hospital outbreak and how that got into the hospital?
Yeah, I don't have any details on that.
Okay. How is it possible we've got 26 cases and a now self-reported death at the Blumenort plant? People there work from all over, but you don't believe there's workplace transmission. How is that possible?
Yeah, it's possible, just like the same question we received in Maple Leaf. As we do the case investigations and we find where people are acquiring it, and we link it to places outside of the workplace. We look at the measures within the workplace which are safe, which reduce the risk of transmission, and so that's where the evidence points us, is that we can link the acquisition to things outside of the workplace.
From Canadian Press, Kelly.
Hello, thank you for the time today. In general, when you speak to schools in the poultry plant, kind of building off Bart's question, you largely say it's not being transmitted in the school or business. So then can you give us a bit more detail about the trends you're seeing where it is being transmitted, especially now that bars and stuff are closed earlier?
Yeah, and so when we start seeing it in the community, this is what we're talking about, where our targeted approach now is difficult because we're not seeing just one place or one venue that these are being transmitted. So it's transmitted in gatherings with families in households. It's being transmitted at other just gatherings within the community and other settings. So it's quite widespread. We're seeing cases certainly in workplaces. We do see transmission in some workplaces, but right now we're seeing community-based transmission, and for the almost by definition we can't necessarily point where that is being acquired. So it's widespread.
And then I'm noticing in the release here, in regards to schools and teachers moving across cohorts such as substitute teachers, why in this case are you recommending medical masks, specifically since most messaging has been non-medical mask usage?
Right. So we certainly use medical masks when people are dealing with cases or in the healthcare setting, or if we determine there to be an increased need for it. So when we talk about teachers that move throughout cohorts, that jeopardizes in a way the integrity of that cohort, right? The whole idea of the cohorts is that if we have a case within that cohort, we do whatever we can that the transmission is going to be limited to that cohort. If you have people who regularly move between cohorts, if that person should ever be a case, then we could have multiple cohorts affected. So wearing a medical grade PPE is one more step involved in further adding integrity to those cohorts.
And final question, building off Barth again, we now have by far the deadliest outbreak at a care home. What lessons have been learned from this that can be implemented going forward so that we don't have similar repeats in other care homes throughout the province?
Yeah, and so the long-term care program at the region has been working quite closely. So I'm sure we're going to be, receiving some of this information over time. I mean, the big thing is with these is the importance of not introducing that virus into these settings. We can't have any issues with PPE. Right, so we have the universal wearing of PPE for these exact purposes, is that somebody can show to work without symptoms, develop symptoms later on, get tested positive, and they were infectious while they're at work. But if they're wearing PPE appropriately the entire time, adhering to infection prevention and control guidelines, we've dramatically decreased the likelihood of that virus being transmitted within that facility. And so, I'm sure there will be lessons learned, but we also know that the safeguards we have in place right now can protect people. It's challenging, but they have to be adhered to at all times.
From CTV Winnipeg, Josh.
Good afternoon, Dr. Roussin. Just picking up on that point of preventing the virus from getting into vulnerable spaces, we're hearing from the union representing home care workers that employees are being sent to homes without being told that a client has COVID-19, partly due to FIA. Instead, they're only being told to wear the appropriate PPE. Should workers have this information before they go into someone's personal space or their home?
I'm not sure about the details of that. We'd have to discuss with the region on what they've decided. I would say that the use of PPE is what's important as well, right? So when we're caring for clients when in high risk settings, that's the whole purpose for the universal PPE wearing. Is because we know there'll be people without symptoms who might be infectious for a short period of time. There might be people with very mild symptoms that don't recognize it. And so we just wear the PPE universally, and that will, protect the person wearing it. And if it's medical PPE, protects the people that they're seeing.
in regards to the outbreak at Headingley Correctional Center, are you aware of how inmates who don't have COVID-19 are able to physically distance in that setting?
Yeah, I think they have, they have their protocols in place with it. So I don't have the details on that, but they've been, responding to this, and right from the beginning have had, their protocols that they follow.
And just on the cases among the workers at the poultry plant in Blumenort, the company and union have cited carpooling as a potential factor. Have public health investigations confirmed this at all?
We've found that there hasn't been transmission within the facility. Some, community acquisition, including carpooling, is something that is being considered.
From City News, Jonas.
Good afternoon, Dr. Roussin. Jonas Gilbart, City News. Just given the numbers, hospitalizations, ICU deaths, kind of feels like we're a bit of on a runaway train here in Manitoba. How close have you guys come to moving us to red in Winnipeg? I guess I know you said that we have some further restrictions we can take on group sizes, but what's the discussion been like around that?
Yeah, well, we've just gone to the orange, the elevated orange this week, so we'll continue to follow that. It's just about seeing these messaging, and I think the numbers that have been climbing like this also send that message to people in Winnipeg, to Manitobans, that we have to change things, that we fell back on the fundamentals. We got back to all that normalcy that we want, but we just know this is what happens when we attempt that. So we have to find ways to limit our contacts outside the house. We need all Manitobans to step up and reduce the risk factors for this, which is prolonged close contact, prolonged indoor contact, and we just see with a lot of these restrictions, very challenging to many businesses. But without these restrictions, we would see even worse numbers than we have now. And so these restrictions are required. We need people to take them seriously, to not look for ways to work around them, because we know the larger gathering sizes put people at risk. Prolonged contact with indoors puts people at risk.
As a follow-up, we introduced this week here in Manitoba some new fines for individuals, for corporations. When it comes to enforcement, your message really has been right now this week, the last couple of weeks, people got to stop gathering. When it comes to enforcing these, do we got enough folks? Is this going to be able to take effect?
Yeah, I think that there's work to increase that ability. From public health, we still want to rely, for the most part, on education, on support. But we know, especially if we want to have a targeted approach, we have to be able to enforce and enforce it in a significant manner to ensure we have everyone on board and that everyone can see how important this is. So there is work, because that definitely is one tool that we will need as we try this targeted approach.
And that's fine for me, guys. Thank you very much. Thank you, sir.
From the Winnipeg Free Press, Danielle.
Good afternoon, Dr. Roussin. I would like to talk about contact tracing. Manitobans are reporting waiting for days, if not a week, to hear from a contact tracer after learning of their positive diagnosis. What does this say about our province's response planning if we do not have enough contact tracers to keep up with the cases that we have today?
Yeah, so in this week and late last week, we have run into a backlog in our cases. We've put a lot of measures in place right now in the immediate term to address that backlog, and then in the near immediate term, we have more resources coming from Canada Red Cross and Statistics Canada to help us with our contact tracing capacity. So early case identification, contact tracing are still paramount in our public health response. So we've had to make some very quick adjustments to get that capacity up.
Okay, thank you. And I'd like to know if Manitoba had more contact tracers, perhaps at the start of our second wave. Do you think we would have had lower case counts today, and why?
Well, it's real hard to talk about, a hypothetical issue. I would say that, like I said, case identification, isolation, contact tracing are really important public health tools. And so we're going to continue to do whatever we can to keep that timeline down. Because it's a very important tool. What would be the result right now in this circumstance, I can't really speak to. What I can say is overall, we're going to be in a better situation if we can maintain our ability to contact trace.
Thank you. And as my last follow-up, can you explain the levels of priority for contact tracing and how public health knows or determines when a positive case should be prioritized for contact?
Yeah, and so that's really what we want to do is just get to all the cases, because the information that public health gets right now is just what's written on the requisition. So it's very hard to see a positive test result and have any idea how what kind of priority it is. So we need to reach that case and determine that. So if there was a student, if they were in a high risk setting, the only way to really figure that out is through the contact tracing process.
From CHVN, Taylor.
Hi, good afternoon, Dr. Roussin. My first question is about that plant in Blumenort. So there are a lot of really small communities in that area who often do rely on each other. When they are going about to other communities with the increase in cases in mind, what should they be mindful of?
So you want to decrease your contact outside of the household. And so if this is carpooling, you want to ensure that no one is symptomatic, and that no one is there that should be self-isolating, as a known contact. And then the typical things like wearing a mask in that car when there's other people in there, washing your hands. So it's really all those fundamentals. So we really have to start decreasing that contact with people outside of our household.
And for families who are experiencing losses, particularly right now with these current restrictions, do you have any messages for them as they go through something quite different?
And I'm sorry, like of families that have lost loved ones?
Yes.
Yeah, I think that's a difficult enough thing to go through at any time, and now you lay a pandemic on top of it. Now you lay increasing restrictions on group sizes on top of it. So it's such a difficult situation, to go through. We're really in this, a 100-year pandemic, and so it's putting a added strain on. On pretty much all Manitobans, but my heart goes out to people who've lost a loved one, whether it's to COVID or otherwise, and then now have to navigate these restrictions on top of already a real tough situation.
And now that the snow has hit, what is the province doing about testing facilities that require people to wait outside?
Yeah, I think that we have we've increased a lot of our testing capacity for it. We have the drive up, we have the drive through sites, and so I think the capacity has been expanded, and and into the colder months we'll be able to deal with with the expected climate.
Thank you, Doctor. That concludes today's media briefing.
Okay, thank you.